Welcome to the special edition of Daily Vet Life, where we're bringing you short interview synopses of presentations from the 2021 AAP convention. These special editions are brought to you by Zoetis. I'm Kim Brown, editor of Equine Management. In this episode, we're talking to Gustavo Zanotto, DVM, MS, PhD, who is boarded by the American College of Veterinary Sports Medicine and Rehabilitation. Currently, he is a clinical assistant professor at Texas A&M University. Dr. Zanotto's research interests are musculoskeletal diagnosis, therapies, and rehabilitation. He spoke at the AAP convention on current joint therapy usage in equine practice changes in the last 10 years. Thank you for joining us today, Dr. Zanotto.
Thanks for having me here.
Well, we really appreciate you joining us. And could you just tell us a little about some of the key points that you discussed in this presentation?
Sure. So just giving a historical perspective on this presentation, we, about 10 years ago, the group of Dr. Frisbee at Colorado State University have done a survey just asking the vets what's the common, a few questions about joint therapies and how the vets in the field are using these therapies. And our thought on this time was just kind of like repeat that same survey to see how joint therapies has been used now compared to 10 years ago. So that's our main goal on this study. And also we're looking to understand how the new therapies that have been developed during this window have been added to the clinical use. So that's basically the motivation behind this study. And it was very interesting to see some of the notes that we have there. Especially when you talk about the use of corticosteroids. Triamcinolone is still the most commonly used corticosteroid in high motion joint. Metoprolol is still the most commonly used steroids on low motion joint. But interestingly, metoprolol use on high motion joint has been decreased. And that's, we believe it's likely to be associated with the evidence we have now saying that metoprolol may be harmful to the cartilage and that may affect more the high motion joint. So that was in agreement with the evidence we have in the science to support that change. We also noticed that betamethasone is being a little bit more commonly used now. That might be because betamethasone is back on the market and more available to the clinicians. When we move to biological therapy, one very interesting thing we saw is biological therapy is more popular now than it was 10 years ago. The autologous conditioned serum, the IRAP therapy, is still the most popular therapy. So most of our respondents said they have been used IRAP, in their clinical practice. So we're noticing a trend on more use of biological therapy. Not discussed on the previous survey was associated with, why the vets are reaching out to biological therapy or what they think about the effects of these biological therapies. And interesting to see vets are one of the reasons they reach out to biological therapy is because they believe that it is a longer term effect of biological therapy compared to the conventional therapies we have been used in horses. And that's interesting. We don't have that evidence in horses yet. However, if you look at the human data, we start to have a little bit more evidence to support that biological therapy might have a long-term effect compared to the current corticosteroid or conventional injections. So that's in agreement, somehow in agreement with the evidence, even though we don't have that on horses yet. So then when you move about the use on the antibiotics associated joint injections, that was a little bit, interesting for us to say that now the clinicians are being using more antibiotics with their injection they report 10 years ago, which is a little bit, contradictory to the scientific evidence that maybe point that joint injections does not increase the risk of sepsis, or better saying corticosteroid injections does not necessarily increase the joint sepsis. So there is some joint therapy might. And just the type of practice being used on the field or in the ambulatory setting or in the hospital does not associate with risk of joint sepsis.
Part of the world's leading animal health company with a 70-year legacy, Zoetis Equine is committed to providing horse care products and services that veterinarians and their teams can count on. With trusted vaccines such as CoriQ and FluVax Innovator, leading diagnostics like the Staple Lab stall-side SAA blood test, and the #1 vet-trusted equine sedative, Dermosedan, and a portfolio of regenerative medicine devices that includes ProStride APS, Zoetis is always by your side. Be sure to follow Zoetis Equine on Facebook and Instagram today.
So regarding to the antibiotic use in joints, we saw an increase in the use of antibiotics associated joint injections, and that might be a little bit in conflict with the current scientific evidence we have. As now we have a suggestion that especially amikacin can be chondrotoxic to the joint. So based on that evidence, that would point against to the commonly use of amikacin associated with joint injections, especially corticosteroids. Especially considering that the evidence, we don't have strong evidence to say that corticosteroids will increase the risk of joint sepsis compared to other therapies injected in the joint. So that's basically how we see it. It's basically we have increase on the use of corticosteroids in the joint that could be in conflict with the scientific evidence that suggests that is might not have the need to use antibiotics, and antibiotics might be harmful for the joint. So that's one point that we note that we need to address and understand how this message is getting to the clinicians and how better we can communicate the science there.
Okay, and that's a really good point. And as far as the biologics in your study, did you talk about which biologics are being used more today?
On the survey, we asked the clinicians which biologicals they have been familiar to, so they have been used. So not necessarily we're asking, how many of them they use, but IRAP or autologous conditioning series is still the most commonly or the most popular biological therapy. So most people have been used IRAP. That's followed by other biological therapies such as PRP, ProStride, and the less commonly used biological therapy was the bone marrow concentrate aspirate. So that's how we saw the breakdown between the data and how familiar the clinicians are to these therapies.
Okay, and were there any other key points from this survey? And that's really interesting to go back and repeat this 10 years later and see how joint therapies have changed. Was there anything else from this survey that you wanted to pass along to veterinarians?
No, I think this few points they summarize really well what we have been seeing so far. I think there is some studies that we still need to be done to support some of the claims we have, especially regarding to biological therapies. That somehow it's a new field for us. But in overall, I think we need to do is just improve the communication from who does the science to the people that actually using the therapies on daily basis, and that's I think was the whole idea of doing this survey. Okay,
and just to ask a little bit about what you're working on, what sort of research are you involved with right now? What is your focus?
So right now, I have a little bit a wide range of research I'm been doing. Some of the therapies I'm looking into are biological therapies, understanding, PRP, platelet concentration, low-cost concentrations in the joints, how that works. Looking for some of the other therapies has been, launched in the market recently that has been, not completely or fully elucidate how that works and how that works. and how well these therapies are over whatever we already have, right? I think that's one of the biggest issues we have in veterinary medicine is seems like every time we have more and more therapies, but we struggle to understand how one therapy compares to the other because we have a very few number of clinical trials out there comparing different therapeutic approaches. And that's basically where I'm trying to focus my research right now, is developing good clinical trials where we can actually answer questions for the clinicians to each therapy, works better, or, in which situations each therapy should be employed.
Well, that's very interesting. I hope we get to talk to you again in the future to see how this research has come out. So thank you very much, Dr. Zanotto, for joining us today on Daily Vet Life. And a big thanks to Zoetis for sponsoring this podcast. We invite our listeners to check out all 12 of these special editions of the Daily Vet Life podcast on your favorite podcast network, or you can visit equinemanagement.com to listen to all of Daily Vet Life summaries from the 2021 AAEP convention.